As the number of confirmed coronavirus cases climbs, some local nurses say they are not receiving the equipment they need to adequately protect themselves and the public as they handle patients with COVID-19. News 8's Richard Allen is live at UC San Diego Health in Hillcrest tonight, where a group of nurses spoke out this evening. Richard?
Well, Marcella, that's right. The CDC earlier changed its guidance on dealing with routine COVID-19 patients, saying that surgical face masks are acceptable rather than using those N95 masks, which are still used in the ICU and during complicated procedures. But nurses here at UC San Diego Health are speaking out, saying they need access to these stronger protections in dealing with all COVID-19 patients to keep everybody healthy and safe.
We need to take immediate action to protect people's health.
These nurses at UC San Diego Health in Hillcrest spoke out Thursday night against what they say are inadequate protections when dealing with COVID-19 patients.
This is not the time to be weakening our standards and protections.
Earlier, the CDC altered its guidance for using masks when dealing with coronavirus patients, moving from airborne protections like N95 respirators to droplet contact protection such as surgical face masks.
We oppose the CDC's changes to its guidance. We also oppose UCSD's decision to lower their standards.
These nurses say that by not using N95 respirators in dealing with all COVID-19 patients, the consequences down the road could be devastating as the number of coronavirus cases continues to climb.
We need to stay healthy, and we need the right staffing and the tools to do our job to protect the public.
But UC San Diego Health says it does not have a shortage of personal protective equipment, but says it is carefully managing its supply, adding it is following the CDC's latest guidelines on masking. In moving to droplet contact protections like gloves, gowns, eye protection, and face masks, not N95 respirators when providing routine care for COVID-19 patients. However, staff here is continuing to use N95 respirators in the ICUs and while doing more complicated procedures like intubation. But these nurses say these revised protocols fall dangerously short of keeping everyone healthy and safe during this growing pandemic.
This is simply not adequate and puts nurses, their families, and the public at risk.
And earlier today, the county's public health officer, Dr. Wilma Wooten, said countywide there is no shortage of N95 respirator masks. However, she did say that supplies of other protective equipment like gloves and goggles is beginning to dwindle. Carlo and Marcella?
All right, Richard, thank you.